Hello, welcome to today's presentation, When It's More Than Baby Blues, Managing Peripartum Depression and Anxiety, presented by Dr. Acosta-Goldstein, psychiatrist with the Washington Health Medical Group. Dr. Acosta is board certified in psychiatry with a Bachelor of Arts degree in biology from Columbia University and a medical degree in general medicine from University of Texas Southwestern Medical Center. Dr. Acosta approaches patients with curiosity and humility, and is always on the path of learning. She believes in recognizing and weighing the cultural upbringing and immersion of her patients. Her practice's interests are women's mental health, particularly peripartum psychiatry, post-abortion, post-miscarriage, and active fertility-infertility treatment. She also holds a special interest in the LGBTQ+ community. Please welcome Dr. Acosta.
Thank you, Kayla. In our society, we are overwhelmed with happy, healthy, glowing images and ideas of pregnancy and new parenthood. For example, here's a collection of photos I gathered from the internet on some quick searches. While this may be some people's experience, the reality is that the majority of birthing persons experience some form of baby blues in the newborn period. Up to 4 in 5 new moms experience some form of the baby blues. Studies show anywhere between 40 to 80% of new parents develop symptoms as well. First, let's talk about why baby blues develop. In the birthing parent, we will see huge hormonal changes in the 3rd trimester and the first couple of weeks postpartum. These hormonal changes partially contribute to brain structure changes so that we can learn to read baby's cues, bond, and form a whole new idea of a person in our minds. We also have big fluid fluctuations that happens in the last trimester as well, the first 2 weeks postpartum, which can temporarily affect the effectiveness of the medications you take and also affect our energy and fatigue. We have body changes, injuries, recovery times, and higher energy needs, not only in those who are breastfeeding, but also those who are formula feeding, probably because they're experiencing fatigue. All parents are going to experience social isolation, very common to experience reality and expectation mismatch, which can lead to disappointment, frustration, including the expectation of having an immediate magical baby bonding experience. The reality is baby bonding is gradual, takes time and progress. Relationship problems like differences in parenting practices, differences in managing stress and distress, and everyone is going to experience sleep deprivation. What symptoms can we expect? Appetite changes, fatigue, forgetfulness, brain fog, anxiety, restlessness, irritability, and mood swings, feeling overwhelmed, feeling stuck, indecisive, brief or occasional sadness and crying, and generally anything that you can personally expect to feel after days to weeks of sleep deprivation. Remember, baby blues starts quickly, is temporary, should not last more than 2 to 4 weeks, and is generally mild. Who is at risk for the baby blues? Every parent with a newborn. That's all. Or that's everybody. When is it more? I'm going to focus on anxiety and depression, but PTSD and OCD have similar symptoms that can start anytime during pregnancy and on, and there are other mental health disorders that can develop in the postpartum period. At least 1 in 5 birthing parents and new moms experience peripartum depression or anxiety. The numbers are very likely closer to 1 in 3 when we consider PTSD, OCD, and other diagnoses. What symptoms are we looking for when it is more? I have these symptoms divided between depression and anxiety as a general reference, but there is definite overlap. In depression, we see deep sadness, deep loneliness, persistent guilt, persistent difficulty bonding, debilitating anxiety, disinterest. This is disinterest in caring for yourself, caring for your children, doing things that bring you fun, help you relax, and generally having a lack of joy. There's dissociating, feeling robotic, feeling disconnected from your body or your surroundings, feeling dejected, unneeded, unnecessary. In anxiety, we have intense or extreme anger, intrusive thoughts, thoughts that don't feel like your own or that interrupt your day, unrelenting anxiety, obsessive thoughts and actions, thoughts of harm coming to you, your baby, or your loved ones, intentional social isolation, and persistent insomnia. This is in the peripartum period, not being able to sleep when you have the opportunity. More about these symptoms. Symptoms happen nearly every day for 2 weeks or more. You do not need to wait for months and months of symptoms to benefit from professional help. Concerning symptoms last more than half the day, interfere with the quality of your life, and prevent you from doing necessary tasks. Symptoms can be mild, moderate, or severe, and they all deserve attention or treatment. Symptoms can begin anytime from pregnancy up to 18 months postpartum. Postpartum, they generally do show up in the first 2 months of your baby's life. In this slide and the next, I will be listing some, but not all of the risk factors that could put someone at risk for peripartum depression and anxiety. I will be going through the ones in bold, which show the highest risk. First, we have families with limited social support, and this could be absence of extended family, absence of having a community. Those that are particularly at risk are those who have an absent or unsupportive partner. Persons of the LGBT community, persons who are in unrepresented or underrepresented minorities or racial groups tend to experience inequities, neglect, microaggressions, prejudice, isolation, and safety concerns. Personal history of peripartum depression and anxiety. Personal history of any mental illness or substance use. And ongoing substance abuse and alcohol show the highest risk of developing peripartum depression and anxiety. What does not increase your risk? Deciding between vaginal or C-section, neither of them are going to put you at a higher risk. Deciding between medicated versus natural delivery, again, not going to change your risk. The gender of the infant in Western societies in general does not increase your risk, but this is different for different communities and cultures. Breastfeeding and newborn skin-to-skin contact may both be protective factors. When is it emergency? Treat the following symptoms as an emergency. Desires or urges to hurt yourself or your children. Thinking of plans to hurt yourself or your children. Hearing voices that are not there. This does exclude phantom cries. Seeing things or people that are not there. Strange or bizarre beliefs or ideas. Or other scary or disturbing thoughts or experiences. These symptoms can mean something more serious is going on. These symptoms can escalate very quickly in the matter of hours to days. And therefore, these symptoms are an emergency. So please call your psychiatrist or mental health provider immediately. Call 911 or go to the emergency room. Lastly, let's talk about treatment approaches. I'm going to start with recommendations for moderate to severe symptoms, which is always seek formal mental health care. Medications are generally always indicated in severe symptoms. For emergency symptoms, if you remember the 2 slides prior, emergency symptoms may require hospitalization, so please go to the ER or call 911 for help. Moderate symptoms may or may not need medication, may or may not require formal talk therapy or intensive therapy, so please seek help from a medical professional. Managing baby blues or mild peripartum symptoms. There's a lot of interesting studies and research out about lifestyle modifications to treat mild depression and anxiety. First, we have exercise, which probably has the strongest evidence of the following 4, but the most limitations in the peripartum period. As with any new exercise plan, start slow and build up. If you have mobility difficulties or are in the first 1 to 2 months postpartum, please discuss with your medical provider first. In general, the recommendation is 150 minutes of cardio per week. Cardio is anything that gets your heart rate up at a sustained level for 20 to 30 minutes. Cardio can be running, walking fast, jogging, dancing, or swimming and biking. Next, we have engaging with nature. The key word is engaging. You're participating with nature. You are feeling the breeze, you're smelling the flowers, you're contemplating about the sunshine on your skin. This is an exercise you can do with your newborn, with your children, and is also beneficial for their mental health, reduces their risk when they are older. Daily sunshine, 20 minutes of daily sunshine, is helpful in the treatment of mild depression and anxiety. It is okay to wear sunscreen. And then lastly, diet changes, specifically reducing animal proteins. This includes red meat, dairy, fish, and chicken, although if you don't want to eliminate all animal proteins, keep the fish and chicken. You also have to increase plant proteins. These are beans, lentils, chickpeas, and other plant proteins that you can look up online. The key to these 4 recommendations is persistence and consistency. You're not going to see a change overnight, but you will see a change with time. These changes can also help if you are on medications because they can make your medication more effective. They can keep you at the lower doses and make it easier for you to get off medication when it's time for that. Like I mentioned before, these 4 recommendations are also beneficial for your children's future mental and physical health, lowering risk for diabetes, lowering risk for attention deficit disorders and other problems. There's also a plethora of softer evidence. I listed some of them here. I would not recommend these alone, but you can use these in combination with medication or some of those 4 lifestyle modifications we talked about earlier. First, we have vitamin supplements like omega-3, folate, and vitamin B3. I always recommend getting your nutrients from food, but if you're not able to do so, purchasing vitamins over the counter can help. Yoga, gratitude exercises. One exercise that I teach my patients is every morning counting on your fingers, one thing that you're grateful for per finger. And if you're having a particularly difficult day, then it's I'm grateful for this finger, and this finger, and this finger, etc. Mindfulness exercise help you stay present. These exercises can be short, 1 to 3 minutes. There are numerous if you Google them online. One exercise that I go over with my patients is putting a piece of chocolate in your mouth, spending 30 seconds thinking about the texture, 30 seconds thinking about the taste, 30 seconds thinking about how fast it melts, etc. I also recommend scheduling at least 1 social engagement per week. This is going to be different for every family member depending on the family member's medical needs and where your social network is. But this can be anything from a FaceTime video with family, going to your religious activity, or participating in nature with a neighbor to fulfill one of the former requirements. And finally, we have a list of must-dos. These are things you must do no matter what treatment plan you choose to go with. First is treating underlying medical problems. Particularly important is treating diabetes, thyroid problems, or low vitamin D. One recommendation I make for every single one of my patients is organizing sleep shifts with your support system, trying to aim so that everyone in the household gets 4 to 6 hours of sleep per night. Abstain from alcohol while you're pregnant, and in postpartum, limit your alcohol intake to less than 2 drinks per week. And abstain from any recreational drug use throughout the peripartum period. Thank you for being here with me. The following are a list of resources that you could use to find help or more information. The first 3 can help you find a therapist or a psychiatrist that specializes in peripartum psychiatry. NAMI.org is a place where you can find more information, and we do have a psychiatry department here at Washington Health.
Thank you, Dr. Acosta. We have a few questions. The first is, what specific actions can partners, family, or friends take to support someone experiencing peripartum depression or anxiety?
There's 3 things that I would recommend. One is asking that person what they would find beneficial. Every single person out there is different, and so are their needs. That is the most important thing that you can do. 2, help them organize sleep schedules. Sleeping is the number 1 thing I recommend for every single one of my patients, no matter what their symptoms are. And 3, I would recommend encouraging or helping them feel comfortable with seeking professional mental health care if they need it.
Thank you. The second question is, can peripartum depression and anxiety come up for non-birthing partners or adoptive parents as well?
It very much can. Any person with the newborn, any family members who are helping with the newborn or experiencing stress, sleep deprivation, can experience the the baby blues that we talked about earlier.
Thank you. This concludes our program. Thank you, Dr. Acosta, for this insightful presentation, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our YouTube page.